Good evening, everyone. It's a video on snake bites and CroFab dosing. It's a video mainly for the hospital pharmacist, but it will also help doctors or nurses and also pharmacy and medical students and also ordinary people. As we know, for the better outcome of a snake bite patient, the sooner the antivenom can be given, the better is the outcome. So any knowledge that any person can have related to this snake bite patient's treatment will be beneficial for the outcome of the patient. So I'm making this video mainly for the hospital pharmacists because snake bite patients don't come very regularly at the hospital. They come all on a sudden out of a surprise, and if the pharmacist that working at that shift is not familiar with a scenario like this, sometimes it gets some time wasted just to get the initial information. So I'm making this video so that a pharmacist or a healthcare practitioner can be well aware of this information beforehand, which will help the patient's treatment to be initiated early. So, for the purpose of snake bites and CroFab dosing, whenever any patients with a snake bite come to a facility, the first thing we should remember is to call the poison control center, because the poison control center have the people, they are trained on these scenarios. They have clinical toxicologists and they can tell how severe is the scenario or what type of snake the patient got bitten by, and also um, how long that treatment should be continued and what should be the dose. Many intricate scenarios and questions that can arise, the poison control center can help. So the first thing we should remember is to call the poison control center, and their number in America is 1-800-222-1222. So there are two types of snake bites can mainly happen in America in a generalized term. One is the coralline snake bites or the coral snake bites. Coral snakes are very rare in America, so it's not very common to have a coral snake bite. So it's kind of a rare scenario, and the antivenom that is used for coral snake bites are is actually North American coral snake antivenom. There are other, but this is the main one, and it's not available at all facilities and all places. It's kept at some central place location in a state or in cities. So if you call the poison control center and if it is determined it was a coral snake bite, they can tell where that antivenom will be available, and if the patient needs to be relocated somewhere, or how that antivenom can be obtained from that central location. So that's for the coral snake bite. But CroFab that we are talking about today for our videos purpose is normally for the cotalin snakes, and this is the more common type of snake bites that hospitals get in their facilities, and CroFab is normally available at the hospitals throughout the America. And cotalin snakes that normally patients get snake bites from are rattlesnakes, water moccasins, cottonmouths, or copperheads. This type of snakes, venomous snakes, are more common in America, and uh, the bites from them is treated by the uh, CroFab antivenom. So the what is the dosing for the CroFab for snake bites from cotalin snakes? It has an initial dose and a maintenance dose. The initial dose is 4 to 6 vials, and that dose may need to be repeated if initial control is not achieved within 1 hour. So the initial dose 4 to 6 vials, and an additional 4 to 6 vials if initial control is not achieved within 1 hour, and the maximum initial dose is 12 vials. This is where calling the poison control center is helpful, because this dose is actually a range, and it's not in a milligram or something, it's by the vials. This is how CroFab comes in vials, and how many vial should be the patient's dose, initial dose. The poison control center can help to determine that. And after the initial control is achieved, the maintenance dose is 2 vial doses every 6 hours for 18 hours. So if you divide 18 by 6, that's 3 doses. So total of 3 doses um, every 6 hours apart. And that also, after that, if a patient needs more doses after that, or if the patient doesn't need all these 3 doses, that the poison control center can tell. Because you have to remember that antivenoms are not also safe. You don't want to give a patient extra if the patient doesn't need, and also you don't want to give the patient underdose if the patient need more to get the control. So it depends on every patient scenario, how severe they are and how many doses they should be um, getting, and how long that treatment should be continued. But for a general purpose of knowledge, for any ordinary scenario, the initial dose is 4 to 6 vials, which can be repeated, and the maximum initial dose 12 vials, and the maintenance dose is 2 vials every 6 hours for 18 hours, which is a total of 3 doses. And how do you mix the vial? The vial comes in a package of 2 vials normally in each package, and you reconstitute each vial of CroFab with 18 ml of normal saline. This 18 ml normal saline doesn't come in the package. You have to use your pharmacist supplies to mix it, and you don't shake the vials. You mix by continuous manual inversions at a rate of 1 to 2 inversions per second. And once you mix the vials with 18 ml of normal saline, you add all those vials, whether it is 4 to 6 vial or for the purpose of maintenance dose 2 vial. This dose should be then mixed into a total volume of 250 ml normal saline IV piggyback. So the final dose you will get into a 250 ml of normal saline IV piggyback. And for the purpose of administration, how you administer that is, then you administer that bag intravenously at least over 1 hour to the patient. So this is some basic information that if a pharmacist is well aware of from beforehand, when he gets a CroFab order for a snake bite patients, this helps to initiate the therapy for the patient quicker. So I hope this video was helpful for you. So please subscribe to the channel, and I hope to see you guys again next time with a similar important video like this. Thank you.